Hello, and welcome to Vaccine Week Day 3, where we're going to be covering vaccines for our youth ages 5 to 17. But before we get into our conversation with our doctor about this, we thought it would be great for you to hear from one of our youth in New Brunswick and his decision to get the vaccine. So let's listen in.
At the beginning of the pandemic, when they said that the vaccine came out, I was very skeptical about it because, you know, it seemed pretty rushed for me. Social media made it seem very different from the real world. So, I was skeptical, and after seeing many friends, family friends, workshops that I was in, I realized I came to the conclusion that it was a good idea to actually get the vaccine to help my community, to help my family, help other people that were also skeptical, to help them get the vaccine as well.
Good evening, everybody. We are now in day 3 of our vaccine week. Thank you for joining us if you've been with us for the last 2 days, and welcome if this is your first one, but know that these will be taped and provided for you. We're going to be providing information on COVID and the vaccines that it's important for you as the community to know so that you have the right and correct information so that you can make accurate decisions, right, on your health and the health of your loved ones and your family. And so that's really a major reason why we're doing this today. My name is Manuel Castañeda, Director of Community Health at New Brunswick Tomorrow. And with me, my partner in crime, as always, Mariam Merced, Director of Community Health at the Community Health Promotions Program, Robert Wood Johnson University Hospital. Mariam, thank you again for joining us.
Can't believe it. We're in day number 2, Manuel. This is
Day
great.
three.
Day 3. My
Look at
God.
that. You're still stuck
yes,
on day 2.
I am missing the days here. But I think that, this is our second round of doing this COVID vaccine week. And, we did it early this year. And we knew that there was an opportunity to do this again because this information about COVID and COVID-19 vaccines is very fluid. It changes a lot. So it's important that our residents have an opportunity to get like Manuel was saying, accurate and timely information so they can make those better decisions, especially now that we have vaccine available for our children. And that's a lot of the things that we're going to be talking all throughout this week. And today is one of those special days because we have a pediatrician with us. And I want to introduce Dr. Shilpa Pai, that is a friend for many years that have been doing a lot of great work here in the city of New Brunswick. She's an associate professor of pediatrics. She works at the Eric B. Chandler Health Center as a pediatrician, which is part of the Robert Wood Johnson Medical School that is also part of Rutgers University. Thank you so much, Dr. Pai, for being with us. It's been a pleasure all these years working with you and the residents that you bring and the experience that you give them in the community.
Yeah, absolutely, Dr. Pine. And it goes without saying, but I want the audience to know who you are, right? And your connection to New Brunswick. So can you speak a bit about, what is your connection to New Brunswick, right?
So yes, thanks, Manny. So as Mariam mentioned, I've been a pediatrician here in New Brunswick for 10 years, over 10 years now. And I work at the Eric B. Chandler Health Center, where I see patients who are coming in primarily from New Brunswick. And these are kids. It's such a joy. I love my job because I see these babies who are born, and then I'm seeing them grow up as they start school and as they enter their new phases of life. So it's been really exciting. And so my patients, I'm sure many of your children are my patients. I have over 1,000 patients that I see. That's our part of my patient panel. And it's just something I really cherish in terms of my career.
Yeah, that's great. And like Mariam said, we can't speak more highly of you. Your work in the community really speaks for itself. So thank you for sharing your time with us today.
From the beginning of the pandemic, you reach out to us. You wanted to make sure that it was not only COVID information, but that people had access to food, to healthy food, to resources. And we appreciate all that work, Dr. Pai.
Absolutely.
Well, I think that's because on a regular basis, every single day, even now, I'm seeing that my families, my patients are struggling and from COVID. So it's one of the things that we're seeing is that they're losing jobs, they don't have access to food, or they don't have access to clothes. But with the COVID pandemic, other issues we're seeing that kids are still getting sick. We're still seeing children with COVID. And I know that a lot of my families are living in closer quarters. So it's hard to physically distance. And if they're getting exposed to COVID and they have COVID, the rule now for kids who have COVID, who have not been vaccinated, now they have to stay home and quarantine for 2 weeks. And because of that, parents who are once started working again now have to stay at home with their child and maybe even lose their job. So it has been something that has hit, this pandemic has really hit our families hard, and has hit me particularly hard because I see my patients, I see the families and how they've been suffering.
Yeah, you bring a great point. I have my 88-year-old dad that lives with me and has a person that takes care of him. And every time that one of the kids has a little cough, they're taking out of school and they have to go to COVID test, and they lose 2-3 days, and there's 2 kids in the house. So one gets out, the other one gets out, and she loses day of work. So you're absolutely right.
Yeah, I can speak from personal experience myself. I got 2 kids in elementary school, and even though the school has done a good job in keeping up with COVID protocols, when they got to shut down or when they got to close in a classroom, the kids are home, right? And so I appreciate and understand. It's a great point that you make, that this is not just a health issue, right? It could become an economic issue. It could become a logistical nightmare, to be quite honest.
Yeah, absolutely. And, one of the things that we're seeing with kids when they get COVID, some of them, people say, oh, but they didn't get that sick. Well, that's fine. But they may have mild symptoms, and they can spread it to people who are at risk. So the elderly or the people who have weaker immune system. And even though if you might think your child might not get sick, we still have had in the United States over 8,000 COVID-related hospitalizations in children. And of those, we've seen 100 children die. And that number is increasing, especially now that we have a new variant. And also, just as a reminder, COVID has now been one of the top 10 causes for death for children aged 5 through 11 years old. And unfortunately, again, working in New Brunswick, my patients are primarily Latino and African American. And those are the families, children who've been more disproportionately affected. Those are the children that we're seeing that are being hospitalized. Black and Latino children. Those are the kids that are dying at a higher rate. So again, this is another reason why this is so important for me to make sure that our kids are protected from COVID.
So with that in mind, you kind of already segued to my next question, right? I think let's break it up, if you don't mind, for vaccines for kids aged 12 to 18, and then we'll talk a bit about vaccines for kids 5 to 11 that was recently approved. But again, let's talk about our kids that are 12 to 18. And you've already alluded to this. Why should they get vaccinated, right? To your point, we've heard a lot of people say, "Oh, but Mike, it doesn't affect them as much. If they get it, they get mild cases. They don't need the vaccine."
Right. So I think this is something I've been saying this from the beginning of the pandemic. It's important where we get our information from. The first things first, if you're looking for adequate information about COVID, talk to your physician, talk to your pediatrician, your family medicine doctor. But if you insist on going online, look at the CDC website, look at WHO website. Please do not look at social media. Please do not look at all these other sites that are spreading false information, because the data, the science that's out there around the vaccines, specifically on Pfizer, which is what the vaccines, what children 12 to 17 years old are eligible for, there have been no serious reactions from the vaccines in the 12 to 17-year-old age group. No one has died from getting the vaccine. There are 2 vaccines, 21 days apart. So people have been getting it, children have been getting it, and they've looked at the data that from adults and be able to use it in children 12 to 17 years old. And there have been no serious infections. And one of the things that you've heard about, maybe about the heart or the myocarditis, again, children have recovered very well from that. And the other thing I just want to point out is that now that we're talking about the booster shots, now they're even saying children who are above 12 and have a weak immune system, they're also eligible to get the third vaccine as well.
Great. Go ahead,
I
ma'am.
really appreciate you talking about those specific things, because we see here that, you know, many of our residents have access to information that is not accurate, and we continue to promote, you know, those websites that you mentioned, the CDC, but also here locally, you know, Live Well, Vivir Bien, Su Salud, you know, PRAB, you know, all those agencies have done a great job in making sure that there's accurate information and timely information, right? At the beginning, everything was in English, and we had, you know, had to run and translate, but a lot of these sites already have information in Spanish, or have that ability to put that little, you know, button and translate things into other languages. So I think that's a very good point that you're bringing.
And I think the other thing I just want to add is that people are worried about, so, you know, we talk about short-term effects. So the side effects from the COVID vaccine. So again, no one has died from the COVID vaccine. Some people will get a little tired. So another thing today, I was talking to one of my patients and talking about getting the COVID vaccine, and the reason they were hesitant because they were worried about being tired. So, you know, the symptoms that we're seeing is that you're tired for maybe 24 hours after the first and or second dose. About like 40% are tired after the first dose and 50% after the second dose. But it's, again, it's manageable. I had, when I got my second dose, I had a little bit of a headache. I still went to work and I was absolutely fine. Other things that you can see are headaches, some muscle pain, maybe a little diarrhea. But again, it's only 24, maximum 48 hours. And your arm can be a little sore, but it goes away in a few days. And it's that versus the risk of getting sick. And severe allergic reactions are very, very rare. And that's only because of one component of the vaccine. But there is no embryos in this vaccine. It is completely not, it's vegan. So there's no animal products or anything in this vaccine. So there is nothing, it's all, it's some saline and some other components, but there's no animal byproducts. And then, you know, I mentioned the short-term side effects, but there's also the long-term side effects that people have been, myths that people have been talking about, such as fertility in boys or girls, long-term, how do we know? So everyone has the different professional associations. So the American Academy of Pediatrics, the Association for OBGYNs have all said that it is safe and there is no issue to be concerned about causing female or male fertility problems, and it does not cause problems with being pregnant. I have given the vaccine to pregnant women who have then delivered healthy babies, and it doesn't affect puberty or the development of puberty as well.
That's great.
I really do appreciate you giving us all that data, and that information is based on data, right? And I think for our parents, that's so important that they know that they have been tracking millions of people that have been vaccinated. And, you know, we get those texts in our, you know, phones and ask us, are you okay? Did you have this? Did you have that? And that somebody's tracking and keeping an eye so better recommendations can be made.
Absolutely. And, you know, just like you guys mentioned about getting your family vaccinated, I don't recommend something that I would not do for my own family. So that said, I was one of the first people to get vaccinated in December. So I got my first dose, I got my second dose, and I got my booster. I got my parents who are both in their 70s. They both got vaccinated. My children who are 12 and 16 years old, a 12-year-old girl, 16-year-old boy, both of them got both of their doses. My nephews who are 5 and 8, both of them have gotten vaccinated. So I would never do something that I would say to do to another child that I wouldn't do for myself or for my children myself.
Yeah, that's a great point, you know, and I think both myself, Miriam, you know, we're vaccinated. Miriam, I know that you recently got your father, you know, his booster. I got my kids who are 10 and 11 vaccinated, and everything went fine. My wife got her booster, so we're on board with that. But now that we've talked a bit about vaccines for 12 to 18, and I think you've really done a great job in at least showing that there is data on this already, right? That this is not just simply people talking without evidence, that this is not adversely, you know, it's not hurting people, right? That it's helping people. But one of the things that we hear in the community now, if we can kind of switch specifically to vaccines for 5 years old to 11 years old, is that concern. We've actually seen parents more concerned about their kids that are younger as opposed to their kids that are older, right? So basic question here, why should we vaccinate our children that are 5 to 11 years old?
So, like, you know, like I said before, our kids are they can get sick. I don't think I can underline that comment enough, because kids can get sick. We are still seeing children in the hospital right here in New Brunswick that are in the hospital. And I'm sure many of you may know people that have been children have been hospitalized, and they have breathing tubes down their throat because they may not have been vaccinated, or more importantly, their parents are not vaccinated, and that's what got them sick. So the other thing is that even though ages 5 to 11 overall do okay if they get sick, but like I said, they can spread it to other people. They can spread it to think about their grandparents, think about other people who may have a weaker immune system because of diabetes, or they're getting cancer treatment. And this is something that, again, I feel very strongly about, because when my dad has cancer and he was being treated with chemotherapy, it was really important that the people around him were vaccinated, because sometimes if kids can't or people can't get vaccinated because of a weak immune system, I mean, it's really, really dangerous. So with this vaccine now that's been approved for children 5 to 11, it has been proven to be safe and effective. It's been authorized, the Food and Drug Administration. And let me tell you, the FDA, or the Food and Drug Administration, is so strict. They won't let you even eat like yogurt if it's 3 days too old. So the fact that the FDA is saying that this is safe, it really sits well with me, and it makes me feel more confident. And the CDC, which is also another agency which really is very strict about health protocols, has recommended it. But even on top of that, the safety for this vaccine has been tested in thousands and thousands of children. And some of my colleagues who are pediatricians, they had their children enrolled in these trials. So, and the fact that they felt comfortable having their own children enrolled in these trials shows how important we all think this is to get our children vaccinated. And in all those thousands and thousands of tests they've done on young children, there has been no serious safety concerns after the child received their vaccines. And the way this has been tested has not, I think there's some incorrect beliefs that this was not tested enough or developed, it was developed too quickly, but that's not true. It's been developed and tested for the vaccine in children in the same exact way as the adult COVID vaccines.
Great. That's a lot of information right now. I don't have any more questions to ask. No, I do have you.
We have one more. We have one more.
Yeah,
I think that
you're very thorough, which is great. And I think this is definitely important information for our families as they start to consider, and vaccinating their children overall. But one of the things that we've heard too is for those people that are getting their kids vaccinated, there's concerns with, okay, well, I just got the COVID vaccine. I can't get any other kid vaccines or the flu. Like right now, you should get your flu vaccine, right? Because we're entering the colder months. Is there an issue with that? So do you have to worry about COVID vaccines and other vaccines?
Nope. It's been safe and been proven to be effective when you're getting the COVID vaccine with other vaccines as well. So there is no contraindication to have to separate the different vaccines or worrying about that at all.
Great.
And I just want to clarify, I'm sorry, Miriam, I just want to clarify that at this point in time, the only vaccine available for kids, 5 to 17 is Pfizer, correct?
Yes, that's correct.
Okay.
Good. This has been such an eye opener for us. You brought up, the data behind the science for our parents to make better decisions. It's one thing when you decide for yourself, but when you're deciding for your children, it's a little different, and you need that additional information that sometimes our parents don't have the time in their busy days and working in factories, to have access to someone to answer these questions. And thank you so much for giving us your time and your expertise in doing this, and also your personal story. I think that touches more people than anything else. When we tell people, that's the first thing that they ask me, did you get it? And I'm like, yes, I did get it. So I think that, our personal experience also touches people's life.
And I will say, when I got like I said, I was one of the first people to get the vaccine. I didn't know anyone else had gotten it. So if you ask me, was I nervous? I was a little nervous. Like, I'm not going to say I wasn't, but I also was in a group of people who were the first people who were on the front line. And so even though as a pediatrician, I wasn't as much on the front lines, or people who've been working in intensive care units. And I've heard horrible stories of them, people working in the emergency rooms, intensive care units, seeing people dying in front of them left and right. So when I saw, and it still brings me chills when I think about it, when I saw those people getting the vaccines, there were tears in their eyes. that the end has come, that the end of this pandemic has come, the end of this pain and the suffering that we thought we couldn't do anything about now can be prevented with the vaccine. So I think for me, that was so powerful, seeing the people around me who have been seeing this day, people dying from COVID every single day for a year, and seeing that it could actually prevent it. We can actually fight against this with the vaccine. And that was, for me, also convinced me to make sure I'm protecting myself, my family, and my patients.
And I also want to say that, you know, when we were doing outreach out there in the community and knocking on doors and visiting restaurants and factories, you know, we heard so much about Eric B. Chandler, and people were so thankful, right, for the work that the clinic has done, that the health center has done in the community. Because many people were like, oh, don't worry, my doctor at Chandler has my vaccine. I'm already registered. I already got it at Chandler. So we know that for many of our residents, you know, that close knit with your physician, right? That relationship with your physician is very important. So I want to tell you, and I also told Dr. Levine that, you know, the work has been amazing, what they have done.
I'll put another plug then. So we are offering vaccines, COVID vaccines for ages 5 and up. It is free of charge. We have it readily available for now. I'm hearing about other places which are running out. So come and get it, come fast and get it. There are no questions asked. So if you are documented or undocumented, with or without papers, we give the vaccine. And so please, please, please come to Chandler, meet me in person, and you can get vaccinated as well.
Yes.
So I really encourage all of you to get vaccinated.
Great.
And be safe.
Once again, thank you very much, Dr. Pai. We appreciate your time, and this was really great information. Thank you.
Thank you. It's my pleasure.
So,
Thank you.
Happy
Mariam,
holidays.
Happy holidays.
Mariam, we've done with day 3. Now we're going to day 4. And just so
Yes.
people know that tomorrow we're going to be covering the new COVID treatments that are out there. We're going to be discussing breakthrough infections. So that means anybody who got the vaccine but then still got sick with COVID, we'll be talking about that as well. And we'll be talking about natural immunity versus vaccines, right? Because there's people that think that just because they've had COVID, they no longer need the vaccine. So we'll talk through that so that people at least have the right information as we talk about those topics. But once again, thank everybody. We'll see you guys tomorrow. Have a great night.
Thank you.
Bye-bye. Good night.
Bye-bye.